Hello everyone, I am so delighted to be talking about one of my favorite treatments, one of my favorite injectables, Sculptra from Galderma. But more importantly, I have a very special guest, and I want to introduce you to Dr. Burke Robinson, who has been a very dear friend and a fabulous facial plastic surgeon that I have been privileged to refer and entrust my patients' care, and maybe a few others. So welcome, and I am so happy you're here. I'd love for everybody to get to know you. We've known each other for many years, but tell all about your training, your trajectory to Atlanta.
Sure.
I'm so happy you're here with me.
Well, thank you for having me. I really appreciate it. It's a pleasure to be here. And my history, to keep it brief, which is hard to do, is I went to college and med school in Tucson, University of Arizona. Did my head and neck residency in the University of Minnesota, and did a private practice facial plastic surgery fellowship with an incredible surgeon, Devinder Mangat. And that was in Vail, Colorado, as well as Cincinnati, Ohio. He had 2 locations. Spent a short time living back in Minneapolis area before I was able to get out of the tundra and somewhere warmer here, and was recruited by a very large group as their solo facial plastic surgeon within a head and neck ENT group. Was with them for 6 years until 2001. And since then, for the last 22 years, I've had my own solo practice.
Wonderful. Yeah. Well, I love that you've been around for a while. We've known each other for a while. And we've shared passion of helping our wonderful patients look great and be healthy. And one of the tools that we both have used over years is an injectable Sculptra that has changed hands as far as different companies that have managed it, and I feel like they've ended now in great hands. But aside of that, I know you've been very passionate about Sculptra. You have been training providers, you've been treating a lot of patients. So let's talk a little bit about this injectable that we both like so much.
Right, and I think it's really where plastic surgeons and dermatologists kind of cross paths, because this is one of those products that we use both every day in our practice, whether it's for skin health, for volume correction, or both. And Sculptra came out initially for volume correction. It was for people who had submalar hollows, temporal hollowing, chin, and we saw great results, right?
Right, absolutely.
But what we both noticed, when you saw these patients in follow-up, not only did you see their volume corrected, but you also saw beautiful skin. There was something going on there, right? So Galderma went back to the FDA and did further studies to not just show how it was great for volume correction, but now they did studies on actual skin health, which I think is very important for us as providers and for the patients to understand that this is something that's been studied by the FDA. And they themselves are certifying, saying this is something that's good for maintenance and prevention, or what we probably say in my practice and yours, pre-juvenation, right?
I mean, I think it's a remarkable injectable. Let's talk a little bit about how it works. I mean, I think that you and I are so familiar with it, but let's review a little bit.
Sure. So what is Sculptra? Sculptra is lactic acid. It's just granules of lactic acid. And it's usually injected either at the level of bone or right below the dermis, right? And as you know, being in the best skinned actor in Atlanta, that when you get something that's near the dermis, it has a good blood supply. And so what happens here is it stimulates cells that have not really decided what they're going to become yet to become cells that make collagen, known as fibroblasts, right? And what's interesting is they've shown recently, the recent studies, and it's being published in scientific data, in scientific journals, that Sculptra in the past was thought to create collagen as a form of scar. So you're creating kind of what we call type 1 collagen and type 3 collagen. And type 1 collagen, it's important for you to understand, is very important for the health of a fibroblast.
Absolutely, yes.
And you know that. And so when you have type 1 collagen, it allows the fibroblasts to attach to that and stay on stretch. As long as they stay on stretch, they keep making collagen. But as you lose type 1 collagen, as you know, by the time you're age 45, you've lost 25% of your collagen. If you haven't done anything such as Sculptra to prevent that, then the fibroblasts lose their connection to these type 1 collagen like bamboo shoots, and they start to collapse, and they reach a critical point where now they start making collagenase, and they're actually accelerating the thinning of the skin, right? So what's beautiful about Sculptra is it can do two things. We talked about how it helps with volume, right, for the hollows, but it also is great for someone even in their 20s and 30s to start that process of prevention.
And I think that's so important to realize, because probably in years past, maybe we were seeing different type of a patient and we're treating them with a little bit different cadence. So with this new FDA clearance, has that changed? Again, I mean, I know we've already mentioned the younger patients, but has that changed the type of a patient that you will talk to about Sculptra and how frequently you would be treating them?
Yes, absolutely. She is dead on. It has totally changed my thought process. Now part of our prevention or pre-juvenation package, beyond neurotoxins, I'll tell patients you don't want to fold your skin like cardboard and create creases that don't go away. So that's prevention, right? BBL, Forever Young, that's good prevention, good health for the skin. And then we also have all the topicals that you can get with your dermatologist. But this is something now that I will recommend below age 45. They do 1 vial a year. And I tell them it's like a thin coat of paint.
Yeah.
It's not going to create volume. You're not going to get big. That's not enough. But it is enough to keep the type 1 collagen there and keep the fibroblasts happy, because that's what we really want, is them to be producing collagen. And once they're over age 45, which is kind of where, as we talked earlier, 25% of the collagen's gone, then we'll go to every 6 months, a vial every 6 months as part of our prevention to help maintain.
And I think this biostimulation is so fabulous about this. I mean, of course, as I do, you use other injectables, and those are very appropriate to consider, but this makes it so unique and so successful. When you prep your patients, do you recommend anything in addition to the correct topicals that you've mentioned, or is this a treatment that anybody can just kind of walk in and get done?
Anybody could walk in and get it done.
Yeah.
And there's really no downtime.
Right.
It's something you can go out that night and no one will know.
Right.
It's rare that you get any bruising with the way we're injecting it now.
Yes.
What's really interesting, I just came back from training the trainer, so I do train people around the country on Sculptra and how to inject it. They had one of the scientists from Sweden, where Galderma is where their main locations are, and he was explaining to us some very new data, which is very interesting. Up until 3 or 4 weeks ago, I thought, like everyone else did, that Sculptra kind of was stimulating collagen like a scar tissue. And some people are kind of hesitant on that. Even surgeons were like, well, that's not good. Later, you're going to do surgery, it may be too adhered.
Right.
But they found now that when you form scar tissue, and you know this, but I had to learn this because I'm a surgeon, not a dermatologist, that when you form scar tissue, you form type 1 collagen, which is what we want, a little bit of what's called type 3 collagen, which is very minor in the skin, but you do not make any elastin. And I'm sure you talk to patients about topical elastin products as well.
Absolutely.
Right?
Yeah.
So when you form scar tissue from trauma or surgery, type 1 and type 3 collagen get formed, but elastin is not formed, okay? So that's a scarring process.
Not true there.
So with Sculptra, what they have found is you form type 1 collagen and elastin.
Yeah.
So they're saying this is not an inflammatory response. This is not a wound healing response. It's a regenerative process.
And I love that word, you know, I mean, I think that we both have mentioned that regeneration and biostimulation is so important. Well, I think it kind of actually opens the door about a few other things that I wanted to ask you, because of course, great injectable, great for pre-juvenation, great for correction still, but of course you see patients and we send you patients that may be interested in some other options. So generally speaking, when do you think it's time to really start thinking about maybe transitioning to a more invasive options?
Sure. Well, first, one thing I want to always say is that injectables don't replace surgery. They complement surgery. surgery does not replace injectables. Anytime I'm doing a consultation with a patient who's there more for regeneration, not a rhinoplasty, more like eyelid surgery or facelift surgery, I always look at them as a whole. I always point out to them what they'll also need injectable-wise post-operatively to make the surgery look its best. So when you start dealing with that, you know, it depends. I always say everyone's like a fine wine. You have to know when's the right time to open the bottle, because some people in their 40s are ready for quite a bit of surgery, and some people in their 60s still just need a little bit here or there as far as injectables in the office. Some of the areas that, you know, injectables cannot help is necks, okay? Platysmal bands, laxity, or liposuction, that's not going to be helped. Jowling, which is different from pre-jowl, right? I bet every day you treat people here, you correct their pre-jowl atrophy, which is loss of volume, and it looks like you just did a facelift, right? Well, surgery doesn't pull tissues tight across depressions. Sometimes people come in and they think they need a lower facelift, and what they really need to do is go back and see you to get this corrected, and that's it. So it's really looking at each person as an individual and what's going to help them the most. It also helps with all these newer injectables we have. The Galderma has all the different Restylane products and the regenerative processes that we can inject. It really has made surgery more predictable, because I can tell them, right, because I can say, you know, this submalar hollowing, we're not going to fix that, okay? Your nasolabial folds, your marionettes, it isn't like this. That's your grandma's facelift. But we will fix it. Or we're going to fix it after surgery when you have the new topography. And then you can go back and see Dr. Pare and let her do her thing.
So do you think that that has, certainly sounds like it's changed your approach, having the ability to use the injectables, but are the facelifts done differently now? I mean, you know, the grandma facelift, of course, we can spot them across town or the US or anywhere else in the world, but a lot of people look terrific, and we know that they've had surgery done. So probably a little bit of a different surgical approach, you know, combining the injectables, yes, but even in surgical techniques.
Yeah, I think one of the most amazing things, it's my favorite procedure, mainly because I don't have to sew. I only use a couple little metal staples, is brow lifts. And brow lifts are amazing because in the past, you basically had to make a very large incision across the top of the head. And then what did you get? Alopecia or hair loss, because there was so much tension placed on that to bring the brows up. Now we do it just like people have arthroscopic surgery, tiny little incisions, or people can have their whole colon removed with 6 little incisions. We do tiny little incisions behind the hairline and use a little scope to come down. We can bring the brow up where we want it, and then we put these little implants that are made out of absorbable suture, and they hold that in place while it heals back to bone. And then what complements that is when there's temporal hollowing, that's where we can come in with Sculptra and get that fourth wall corrected.
That's amazing.
So yeah, it's less downtime, no numbness, no hair loss. Patients are happy.
You know, I think I love hearing that, because although we do a little bit of brow lifting with neuromodulators, that is one area that I do feel, you know, if you kind of run out of the ability to help non-invasively, really benefits surgically. You know, and then of course the jawline. Everybody wants that really fabulous sharp jawline. I know that I send a lot of patients ultimately for the neck lift that you have mentioned, and for kind of manipulation of the lower jaw. So I imagine that's also a very popular area for your patients to come and discuss beyond non-invasive treatments.
It is, and it's kind of interesting to see us share patients back and forth, because they start early with you with a neuromodulator, a Botox or a Dysport, and you can get a little bit of elevation. And then you can reach a point where it becomes more of a surgical situation. Same thing with the jawline. Early on, you're just filling in that little bit here, maybe doing a little contouring at the angle of the mandible, and they're doing great. Then they get a little later, and especially when the neck starts to relax, then it becomes more of a surgical thing. But they will flip back to still needing their contour here with their fillers.
Yeah. Do you feel like it's changed a little bit? Are you getting more male patients? Because we certainly spend a lot of time making sure and emphasizing that although the aesthetics of a female and male face are very different, these treatments, injectables, procedures are very appropriate to consider for both.
Absolutely, yeah. More and more men coming in. I mean, look at what I'm wearing. Okay.
We match, and I'm purple.
Yeah, I got the memo. We dressed, we matched.
That's right.
But I think of my dad, who worked in downtown Chicago in the Loop. He went to Brooks Brothers. He had 7 navy blue suits, and he wore the same one every day with a blue and red rep tie. No man dresses like that now. And my wife.
I might know one. I'm just teasing.
My wife says we like eye candy too.
Yeah.
And I think men have more liberty now to have a little more panache in how they dress and how they groom and take care of themselves with different hairstyles. And it doesn't stop there.
Right.
It has to also do with just taking care of yourself.
Right.
Not only just how you eat and work out, but how your face looks.
And I think what I love hearing is, for example, the ease of the brow lift. I mean, a surgical procedure, of course, is surgical procedure needs to be done appropriately, but the recovery is different, and I think that does open it more to the patient that may have less time or less ability to cover up with makeup or, topicals or so forth.
Sure.
Yeah.
Another nice procedure that's really been around for a while, but not all surgeons adopted, is when we're doing lower blepharoplasty for fat herniation. It's done behind the eyelid. There's no external incision, there's no scar, which significantly reduces the risk of vertical shortening or pulling the eyelid down, which you can see on poorly done surgery. But even in the best of hands, sometimes that would occur. So surgically talking, our techniques continue to get better and better. Now in rhinoplasty, I just presented 160 cases of using fresh frozen cadaver rib. We can do so many more advanced things that stabilizes and locks the nose in, that's biotolerated by the human, it's not rejected, that we just are able to be more advanced in what we're trying to achieve even with rhinoplasties.
That's remarkable. All of you can tell that I could just spend hours sitting and chatting. I think that this is so fascinating. The message for me, though, that's so important is, and I love that you so eloquently put this, is the holistic look at the patient, and really being able to collaborate as physicians, putting together different tools, surgical, non-surgical, that really come together in a beautiful result. And I'm thrilled that Sculptra has been so incredible in your hands. I have used it for years. Everybody knows personally and with patients, and it really is a remarkable injectable. So I think I am always so proud of the Atlanta community, medical community, that we can sit down together, that we can share experience and expertise. We learn so much from you, and patients only benefit.
Well, thank you. It's been a pleasure here, and I always love our collegiality and sharing our notes with each other for the benefit of everyone out there.
Well, thank you all, and thank you for joining me.
Thank you.
Great to see you.